most important considerations that need to be made when we're talking about cosmetic dentistry?
Thank you, Janie. I think trust is one of the most important ones, in that you need to be able to relate to your clinician, that they can listen and understand what you're talking about, that they can provide options for you. Cosmetic dentistry has three particular parts to it. There is a clinical side, a scientific side, there's also an artistic side, and there's also a technical backup side that also needs to be undertaken at a high degree of skill. So there's many factors involved in it. At the Macquarie Street Centre also we spend a lot of time in personalising a smile. So we have digital analysis of our patients so that we can give the patient a good preview of what their expectations can be.
Okay, and in terms of developments, what are the most exciting developments we're seeing in cosmetic dentistry right now? Because I know it's a field that continually changes at a rapid rate.
Just for example, in implant technologies, we're able to handle from a single tooth case, in other words, a young girl that may be congenitally missing a tooth or been hit by a tennis racket or something like that, through to somebody that's missing all of their teeth and has had to suffer the indignity of not having teeth for all their lives. So implant technologies have improved that we can do this faster and simpler and frankly more cost effectively too.
But what about a more natural result? I mean, everybody's so familiar with that whole fake cosmetic dentistry look.
Yes,
are the effects natural?
Creating a natural smile is about, again, working with that patient, and there's a psychology and a personality to a smile. There's an age, a sex, a race. All of these are variables that need to be fed into the sieve to work out what is the most appropriate smile. You
were saying that there are certain lifestyle factors that actually lead people to come and seek out cosmetic dentistry. What are these?
Yeah, sadly, we're seeing two groups of patients. One is the patient that is grinding their teeth. I suppose
this is what we've got up here now, isn't it?
And we can see a patient on the left-hand side there. You can see the wear on their teeth. And this technology is one of the other technological advancements in cosmetic dentistry. We don't have to be as destructive. It's bonded porcelain. And we can utilise this technology to be conservative and yet create long-term aesthetic and functional solutions for patients.
What's the whole after-treatment care program about that you offer?
We have a preventative maintenance care, so when our patients finish treatment, they're not just left. We have specialised hygienists. They're examined every 6 months. We have our radiographs and cone beam scans and all the rest of it so that we can maintain our patients so that they can enjoy the benefits of treatment over decades to come. Another preventative care, and it's one we've developed a special CAD/CAM designed night guard for people that do grind their teeth. So again, it's very passively fitting and will prevent the damage to their dentition.
Yeah, it's quite interesting how, and it's so widespread now, the amount of grinding that people do, and just purely through the stressful lives we lead. So I think I was grinding my teeth so much the other night, I woke myself up. It was quite scary. Anyway, thank you. You've inspired me to give up the Diet Coke. So
good, you, Janie. I've achieved that.
Please go over and see Dr. Dunn later if you have any other questions.
Thank you, Janie.
Thank you.